Thank you so much for inviting me. In thinking about what to say for a keynote for a program like this, I decided to follow a bit of the route, at least that I have taken as a leader. And as I present this material, I want you to be thinking, and particularly as you listen to the others who will be talking about their leadership journeys, I want you to be thinking about the relationships. Professor Frerich said you need trust, and you build trust through relationships. A little bit about my personal history. I have led the development of 3 clinical programs, each one larger and more extensive. I've trained more than 100 palliative medicine specialist physicians over my career. I'm old, I just turned 65. And I've mentored them and many more in leadership skills. And I'm probably most known for leading the development of specialist recognition for palliative medicine in the United States. But at least I find endless rejuvenation and inspiration, and I learn things from my patients. So I want to start with a little video clip of a patient of mine, Peppy Chernoff. I met her after she had been diagnosed with stage 4 inflammatory breast cancer. And you all know what a poor prognosis that diagnosis holds. And you will see I was interviewing her, but she talks about when she first met me.
I was originally diagnosed with stage 4 metastatic breast cancer. From the get-go, do not pass go, do not collect $200, just go to the top of the class. And I thought it was a death sentence, and I took very, very, very aggressive chemo that practically killed me, but I was getting over it. Anyway, I get a call from Cindy saying that you would like to come and see me. And I'm thinking, a doctor that makes house calls? This is very interesting, but I was sort of skeptical, because then I figured, oh God, I'm in worse condition than I thought. I knew I was bad, but I didn't know I was that bad. And when I first met you, I remember the first thing I said to you, do not mention 2 words to me. Do not mention palliative care, and do not mention hospice.
I hope you recognize aspects of Peppy. You probably can tell she's from New York. I was seeing her in the middle of the United States, in the Midwest, where New Yorkers scare people. But think about what you and your colleagues and the people in your programs do when they engage with patients. There's a standard approach to patient care where you need to make a connection with the patient. And probably the most powerful technique that we use in palliative medicine is we begin by asking questions. We ask what the patient understands, what the family understands, what they're hoping for. Did you catch perhaps why Peppy essentially greeted me at the door and says, don't you dare use these 2 words? She's frightened. And then whatever the circumstances, we make a plan. Now, the key insight, I would say, to my career, and I would urge you to think it's important for your career, and I want you to listen to this in each of the presentations, is those same skills we use with patients work just as well with our colleagues, particularly in leadership roles, and particularly when you're building a program, especially during the period of COVID-19 when everyone is frightened and uncertain.
I think people have to be educated on really what is palliative care, and that it doesn't mean that you're going to die tomorrow or you're going to die next week, and it doesn't mean hospice. It means the whole system of care. It means pain management. It means having somebody as wonderful as Charles coming to your house, once a month and talking to you and giving you a lot of courage and a lot of moral support and listening to you, I hate to say bitch, but, complain about things or tell them happy things.
So it should strike you, as it struck me, here was an individual who was frightened to death and wanted not to hear a word about hospice or palliative care. And yet by continued engagement, by focusing on developing the relationship, Peppy learned what palliative care could do for her. And now she's the biggest advocate. I've seen this over and over with administrators, chairmen of departments of surgery and medicine and finance and healthcare leadership across the system. They frequently go from fear or ignorance, but I feel like I've succeeded when they are the advocates and they're the one advocating, not just me. So this relationship development, making a connection, asking about their views, listening more than you're talking works just as well in leadership skills as it does in patient care. Now this takes courage. It took courage for me to continue with Peppy, a very fierce New Yorker. And I'm a Midwestern, calm, mild-mannered guy. But I've learned how to deal with New Yorkers. They're not all that different from the rest of the world. You may be frightened by some of the people you need to engage with in your health system, in your political system. So courage is key to developing relationships. One of the things I've done that is a core piece of my success, I make appointments to go see people in their office. In the times of COVID, it's a Zoom call. But the point is engaging with people when they're alone, quiet, and able to talk, and having genuine curiosity, including for the person that that has told you they're not interested in your program or they're not going to support palliative care. There are generally good reasons behind it. If you can put yourself in their shoes, generally things become very clear. When I was pursuing the development of the specialty in the U.S., and I went to see the heads of surgery, internal medicine, pediatrics, oncology across the country, I thought I was a very young doctor at the time. But it was fun meeting people with different points of view. The biggest thing I learned, I think of surgeons as omnipotent, powerful people, and it turned out they were afraid of the internal medicine doctors for a variety of reasons. That was a very useful thing to know, and the only way I knew that was from talking one-on-one with the chairman of the board of surgery. The other thing I would highlight, we are often so focused on patient care and working for good patient care. It's useful to think there are other reasons why people will support what you want to develop that don't necessarily have to do with good patient care. One of the main drivers that is universal around the world is there's never enough money. There is never enough space. Whoever you are asking has many people asking all at the same time. I think about parents. Many of you are parents. Do you know that sinking feeling you have when one child comes and asks you for something and you think, oh, if I do it for this child, I'm going to have to do it for all the children. I have to make choices because there's not enough for everyone. The second, and Pepe is an illustration of this, patients live longer when they get palliative care. This is a well-established scientific fact. Pepe lived 5 years, and she should have lived about 6 months. I assure you it wasn't the chemotherapy. It was stopped because it wasn't working. Patients live longer. That's a different reason for people getting behind your program than good symptom control and good family care. The other that seems to be clear is that there is reduced staff turnover. That's physicians and others, and this is especially germane in the COVID-19 pandemic, where keeping enough staff going on the front lines. So in that relationship development, listen for the win-win. What is this person needing? What are they afraid of? What are they hoping for? The same things you ask patients, you can ask of your administrative colleagues and those who have the power to help you develop your programs. Listen for that in the presentations today. But this is a paradox. Sometimes support is sustained for reasons other than direct patient benefits. When I was developing the palliative care program for the Cancer Center at the University of California, San Diego, the president and chief executive of the system said, "Charles, I have a 50% turnover of medical oncologists." 50%, that means half were leaving every year. We put the program in place and the turnover stopped. The doctors were happy. The doctors were able then to take care of the patients, and that made the patients happy, and that made the health system happy. So you will find support if you are open to, there are many reasons to support palliative care, not just good patient care. Early in my career, an administrator had the courage to tell me, "Charles, get the anger out." I didn't realize it, but I was so annoyed by the poor care I saw in the hospital I was at, and it crept out. That is so off-putting. People don't like evangelists. They want someone to come alongside. Another colleague told me, which was so true, and it relates to this, in all fairy tales, the dragon is always killed. Think about that. Even though dragons are scary, even though they breathe fire, and I can certainly do that. I know how to do that. But in the end, the dragon is always killed. So if you, or as you are helping your colleagues see a dragon, this is the thing I think will stop them short. You need to be a colleague, and I want you to listen today for how the leaders here have been colleagues, not evangelists or preachers. So this is the key take-home from my keynote. It's all about the relationships, not just those you develop with patients and families, and not just with the colleagues that work with you on your teams, but with the people in the other departments, in finance, in the ministries of health. It's all about the relationships. And if you put that first and foremost, the rest follows and successful programs grow. I wish you the best in this Congress and in your future work leading, because it rises and falls on leadership. And if you develop the relationships, you will be successful. Thanks for asking me to be here.